Did you know over 80% of all patients search online before they come into our offices? And almost everybody goes online after their office to look at our Google reviews, etc. And most of our Google reviews are not about the quality of the care, but more of the quality of the experience that they have in our office. And a lot of that has something to do with not just us, the doctors and healthcare providers, but our clinical team. So let me go over three things. Number one, run on time. Number two, don't cause pain. And number three, be honest. Let's take number one. People want you to run on time because it's basically a commitment. If you make a commitment to see someone at 8 o'clock, be ready to see them at 8 o'clock, not 8:05, not 8:10, not 8:15. Now, I know sometimes we can have complications and things can go longer. In that case, we can inform the patient either we're running a little bit late, they can come later, or would they mind sitting for a few minutes or have a cup of coffee? At least inform them if we're running late, but don't consistently run late. I know for me, when I go to see some doctors, I know I'm going to have to wait an hour and a half. And there's not much I can do about it because they're the only doctor. But people have other choices besides me to see, especially in dentistry. People don't like to be held hostage by sitting there in the reception area waiting and waiting. Now, it's not just us doctors. It's our hygienists. Oftentimes, the hygienists will run late, and they don't seem to be always aware of their time as well. So it's important that the whole team run on time because patients don't like to be kept waiting. The second thing is don't cause any pain. Now, that seems very simple, but there's no reason for patients to feel any pain whatsoever in the dental office. But the number one reason why patients don't come see the dentist is because they're afraid of pain. By pre-medicating patients with ibuprofen or Tylenol, they'll have less postoperative pain because we stop the prostaglandins from forming. If we use a gentle surgical technique or injection technique with topicals and take our time, they'll hardly feel the injection. Or we can sedate them before they come in. And by giving them Marcaine or something that's long-acting, they'll be numb for hours after the procedure. And we give them a dosing schedule. So it's very rare for any of my patients to feel any pain for the first couple of days after treatment. The only reason they're in pain is they don't take their medications as directed. But we give them instructions and our phone numbers so they can call us. And the third thing, which may sound sort of simple, or maybe even sounds a little bit unreasonable, is be honest. Are we always honest with our patients? Do we always tell them everything that they want to know or need to know? They may not want to know it all, but we need to know it so they can make the right decision. What do I mean by that? An educated patient is our best consumer. That's an old expression by Cy Sims, who used to run a clothing factory here in the Northeast. He sold discount clothes at wholesale prices. And his tagline was, an educated customer is our best consumer. Well, I feel the same thing is true in dentistry. An educated patient is our best consumer. My patients that are educated as the pros and cons, the costs, the risks, and all the benefits that they have for treatment are the ones that will make the best decisions for themselves. Oftentimes, I have to say to the patient, I have to tell you this so that you don't make the wrong decision. I have to protect you from hurting yourself because patients will sometimes ask us some crazy things like, can you take this infected tooth out and put an implant in immediately because I saw it on TV? And I go, yeah, I can do it, but you might get recession and postoperative infection. I may have to redo it. I have to tell them all the pros and cons of everything. Tell the patients everything. I know some dentists that are afraid to tell the patients everything because they're afraid of rejection. They don't want the patient to say no to treatment. And I think that's true not just for, one or two dentists, but for most of us, myself included. I don't like patients to reject me. I don't like anybody to reject me. Most of us want to be accepted, cared for, and loved by everybody. So if I get a bad Google review, I go, oh God, somebody doesn't like me. If I don't get that many likes on an Instagram posting, oh, nobody liked that post. We all tend to be that way, especially with social media, we're caught up in that. So sometimes we're not always as honest as we want to be or should be with our patients because we may not have the confrontational tolerance to listen to them say no to us. But what I found over the years, if I'm completely honest, I no longer have the responsibility for making the right decision for the patient because they have all the information. I can help guide them through that process. And by helping guide them through the process, what I found is more people are saying yes to comprehensive care and doing the right thing for themselves. So if you want to get more Google reviews, try these three things. All right? Run on time. Don't cause any pain. And be honest with your patients. Thanks for listening. And as I know you all will, continue to be the gift.